लटवा न्यूज के स्टूडियो से नवीनतम अपडेट। मेघालय राज्य के मुख्यमंत्री कॉनरेड के संगमा ने आज मेघालय में 12 जिले अस्पतालों और 2 टेली आईसीयू हब में 10 बिस्तरों वाले आईसीयू परियोजना का वर्चुअल शुभारंभ किया। लॉन्चिंग के दौरान स्वास्थ्य मंत्री अम्परिन लिंगडो, मुख्य सचिव डीपी वालांग, स्वास्थ्य एवं परिवार कल्याण विभाग के प्रमुख सचिव संपत कुमार, अधिकारियों के साथ हितधारकों और अन्य लोगों की उपस्थिति रही। ये परियोजना विनोद घोषला फैमिली फाउंडेशन और HDFC बैंक परिवर्तन द्वारा दान किए गए है। मुख्यमंत्री ने कहा कि राज्य की चुनौतीपूर्ण इलाकों में गंभीर देखभाल का प्रावधान विशेष रूप से ग्रामीण क्षेत्र में एक बड़ी चुनौती रही है। इससे लोगों को बड़ी कठिनाई होती है। 10 बिस्तरों वाले आईसीयू प्रोजेक्ट और टेली आईसीयू हब अद्भुत पहल है जो जिलों में आईसीयू वार्डों में विशेषज्ञों को जोड़ने के लिए कॉल तकनीक का उपयोग करेंगे। ये प्रौद्योगिकी और डेटा संचालन पहल मेघालय में स्वास्थ्य सेवा में बदलाव के लिए एक स्वागत योग्य कदम है। संगमा ने कहा, इस परियोजना में जिला अस्पतालों में आईसीयू सुविधाओं का प्रावधान और एक ऑनलाइन टेली हेल्थ प्लेटफॉर्म शामिल है जो आईसीयू रोगियों और उनकी स्थानीय स्वास्थ्य सेवा प्रदाताओं को चिकित्सा विशेषज्ञों से जोड़ता है। साथ ही वास्तविक समय डेटा भी प्रदान करते हुए मरीजों को आवश्यक चिकित्सा देने के लिए जमीन पर स्वास्थ्य सेवा प्रदाताओं की अत्यधिक सहायता करेगा।
The PMO needs to monitor and review the project implementation actively. The hub and the spoke ICU network is an improvement over a standalone ICU ward in the public.
With the implementation of this ICU, cases referred from the other district will be.
And even have a look at the status of the patient. For example, if you have an injury, you can even look at the pupils to see how the pupils are reacting. And we need to build in real-time care.
Training and capacity building is an important pillar for building the capability to handle complex cases. In collaboration with Hub Hospital and resource organizations, we provide rigorous training.
With this application in place and with the better connectivity in place, so many patients can.
Is regarding the MMR, and just to give you an idea that the average in India, the national average was 113 in 2019. This is just 1 year after we had taken over. 113 was the MMR in the country, national average, and Meghalaya was 200 plus. So we were looking at about 200, 220 numbers. So 113 was a national average, and we were 200 plus in terms of MMR. In a matter of 3 years, now at 2022-2023, Indian national average is still 113, whereas Meghalaya has come down from 220 plus today at 120. And we are very close to touching the national average and hopefully coming below it very soon. And these things have not been done because of huge investments being made on new technology or anything like that, but by ensuring that our team, our officials, our doctors, our nurses, the different kind of services at the grassroots level are provided at the right time. We are able to use simple technologies to map and to monitor our high-risk mothers and be able to intervene at the right time with the right resources and the right manpower. And just by doing simple things like these, we were able to transform and change the sector. And I hope that we will continue to do this and be able to come down below the national average in maybe a couple of years. So this will be a huge achievement, and I must say this credit goes to all of you who is in this room today. Each and every one of you has contributed to making these small differences in our people's lives, which are very, very meaningful. Through the telemedicine, we will give the healthcare services, but while we do that, as I said, we are creating a massive database, a massive predictability model, and AI being part of that will allow us now to transform and be able to create a better preventive medication system in the coming days. And that's what really is the most exciting part about what technology is doing in the health sector. And I'm sure that this will have a huge impact in how we do things in the future. While speaking of that, I also want to add that when technology is being implemented, so that all our listeners and our guests who have joined us, especially Mr. Kaushla and Mr. Nilikani, would be happy to know that we have a very, very massive and a strong program for IT in our state. I am handling the IT portfolio myself because it's a very, very important portfolio, and we have just finalized our entire optical fiber network connectivity in the state, down to the block level, down to every PHC and CHC, and we will start implementing this in the next 2 to 3 months. Some already are connected, but most of them are not, and so we will be starting this entire network.
लतवा न्यूज़ के स्टूडियो से नवीनतम अपडेट।